classification. One is toast classification, another is Bamford classification. But commonly I'll concentrate on Bamford. I've got a video on toast, so I'll forward that. But Bamford classification is the most commonly used. Okay. Have you heard about Bamford classification? First of all, it is also called Oxford Stroke Scale. Okay. Why is it called Bamford as well? Bamford classification. Can Josh come tomorrow and come up with a new classification, and we'll say Josh classification from tomorrow? Is it possible? So what do you need to do to put your name?
Research.
Yes, so you need to do research to prove your point. Okay, and Bamford did that research in, so he did the research in Oxford, so that's why it's also called Oxford Stroke Scale. So it's a very interesting, it is based on an article which was published in Lancet in 1991. Okay, so in this article what he showed, so the whole team took 647 patients with clinical diagnosis of stroke. Clinical diagnosis of stroke, they took 647 patients. And then they confirmed the vascular territory of that stroke. Okay, where was the vascular territory involved? So they had taken 647 patients with stroke and confirmed vascular territory. How did they confirm? Not by history. How can you confirm the vascular territory? Either by doing CT scan, very few had MRI, very few, but lot of them, what else you can do to prove where exact vascular territory is affected? No, examination has confirmed stroke. They have got an idea which is the vascular territory, but you are confirming it conclusively. How can you do? So CT will give a confirmation. MRI, but at that time MRI was not that, so there was only negligible amount where they had MRI. What else can you do? That won't give you the damage. Patient is dead, you do autopsy. Autopsy. Okay, when the patient is dead, patient has autopsy to prove. Okay, that's how you confirm. So they took history, meticulous history, and did examination to confirm stroke and clinically confirm the vascular territory, and then they confirmed, and then they combined these two data and came up with a classification which is robust enough. So even after 1991, means 33 years, it's still the established classification. Okay, so what did they come with? So they came up with anterior and posterior circulation stroke. First of all, what do we mean by anterior circulation stroke and what do we mean by posterior circulation stroke? So what do we mean by anterior, please? Partial correct. Only middle cerebral artery is anterior? So any part of the brain which is supplied by carotid artery or its branches are called anterior circulation. Any part of the brain which is supplied by the vertebro-basilar system is called posterior circulation. Is that clear? So because carotid comes more anteriorly than vertebrobasilar system more posterior. That is called, one is called anterior, one is called posterior circulation. Okay. Now first of all I'll give you the formula, but then I'll go on to explain how this formula will work. So there are three criteria in, and so what are the parts of the brain grossly? What are the parts of the brain grossly which are supplied by anterior circulation? So if we take, this is the lateral view of the brain. Let me see if I can draw it. Become a bit asymmetric. So these are the, so this is the lateral view of the brain, this is the medial view of the brain, and this is the basal view of the brain. Okay, so one is lateral view, means you are seeing the brain. So this is a, puzzle. Okay. Walked a long distance to get it, so I'll set it up. This is frontal lobe. I'm not attaching the cerebellum. The cerebellum would be like this. Okay, so we're not attaching that. So this is the lateral view. Okay, this is the medial view. Okay, and this is the basal view. So that's the basal view. Okay, clear? Now, out of this, which are the parts which are supplied by the anterior circulation? lateral view. Which are the parts which are supplied by the anterior circulation? So all of the frontal lobe, all of the parietal lobe, superficial part of the temporal lobe are supplied by the anterior circulation. So we can, so this is the part supplied by the posterior circulation, and the whole part beyond this is supplied by the posterior circulation. Now in terms of this part is supplied by the posterior circulation, and then the medial side of the temporal lobe and deeper part of the temporal lobe are supplied by the posterior circulation. This part of the corpus callosum is supplied by the posterior circulation. Is that clear? Okay. So let's do posterior circulation is easier. Whole of the occipital lobe, deeper part of the temporal lobe is supplied by the posterior circulation. Okay. And then the whole of the brainstem cerebellum, plus it supplies some deeper tissue like thalamus. Okay. So if you see here, so occipital lobe supplied by posterior circulation, deeper part of the temporal lobe supplied by posterior circulation, the posterior part of the corpus callosum supplied by the posterior circulation, the thalamus is supplied by the posterior circulation, and then the midbrain, pons, medulla and cerebellum is supplied by the posterior circulation. Clear up to this? Okay. Now the anterior circulation we will divide into two parts. One mainly supplied by the anterior cerebral artery, and one mainly supplied by the posterior middle cerebral artery. Okay. Now coming on to the middle cerebral artery, which part is supplying the middle cerebral artery? Which part of the brain? So let's see the lateral side. Lateral side, most of it is supplied by the middle cerebral artery. So the lateral part of the frontal lobe, the lateral part of the parietal lobe, the superficial part of the temporal lobe. Clear? And also the orbital part of the frontal lobe. Do you know which is the orbital part? So see, this is the frontal lobe. Behind is the central sulcus, front is the frontal pole, and laterally is the sylvian fissure. Okay. So this is the lateral surface. This is the medial surface. Okay. This is the lateral surface. This is the medial surface, and this is the orbital surface. Orbital surface, lateral surface is supplied by middle cerebral artery. This part is supplied by the anterior cerebral artery. Okay, clear? Parietal lobe, lateral part is supplied by the middle cerebral artery. Medial part is supplied by the anterior cerebral artery. Okay, and also deeper part of the, so for example, you can see, and insular cortex is supplied by the middle cerebral artery as well. Middle cerebral artery. Okay, we'll come to that how it divides. But on top of that, the basal ganglion is supplied by the middle cerebral artery, except caudate nucleus, which is supplied by the anterior cerebral artery. And most of the part of the main part of the internal capsule is supplied by middle cerebral artery, whereas corpus callosum is supplied by anterior cerebral artery. Okay, so these are the, so anterior circulation, if we take in whole, what are the parts which is supplying the anterior circulation? The whole of the frontal lobe, the whole of the parietal lobe, the deeper part of the temporal lobe, and the insular cortex, anterior circulation. And deeper structure include basal ganglion, internal capsule. Clear? Okay. And posterior circulation, rest. Now what are the symptoms which are included in Bamford classification. So for anterior circulation, he has included the following symptom. One is weakness or sensory impairment greater than 2/3 of the limbs. Number one. Number two, higher mental function associated with anterior circulation. We'll come to that in detail. And number three is homonymous hemianopia with macular involvement. So three criteria, number one, number two, number three, okay? These are all symptoms of anterior circulation. Weakness or sensory impairment, higher mental function associated with anterior circulation, and homonymous hemianopia with macular involvement, macular vision involvement. If you have got 1 plus 2 plus 3, it is called total anterior circulation stroke. If you have got any two of three or higher mental function abnormality, it is called PAX, partial anterior circulation stroke. If you have got only weakness or sensory impairment or isolated ataxia, it is called lacunar anterior circulation stroke. Is that clear?
Sorry, could you explain the lax again? So that's a...
We'll come to explain it, but just remember the formula. If you have got weakness or sensory impairment or isolated ataxia, that's a feature of lax. Is that clear? Okay. Now, we have said that anterior circulation. So let's quickly recap the blood supply of the brain. So where does the blood supply of the brain come from? We have said carotid and vertebrobasilar system. Where does the carotid artery originate? So the common carotid artery arises from arch of aorta. That's right. So on the right side, how does it originate? Common carotid artery, does it originate directly from arch of aorta? Brachiocephalic. On the left side? Direct branch. Okay. So on the right side it arises as brachiocephalic, on the left side it's a direct branch of the arch of aorta. Now the common carotid artery goes along the neck at the level of the thyroid cartilage or C4, but it can vary. Okay. It divides into internal and external. Okay. What does the external carotid artery supply? Okay, first of all, internal carotid artery, what does it supply in neck? In the neck?
Thyroid.
Thyroid, according to Charlotte. Anything else? Don't take it as correct. Harriet?
Did you say internal or external?
Internal in the neck. Emily, you're not immune to So internal has got no branch in neck. Everything, thyroid, parathyroid, everything is supplied by external. Okay, it's very easy to remember. It's a trick question for...
Thought you said external.
Hmm?
Thought you said external.
So, okay, okay. Shall tell me what does the external supply inside the skull?
No, it's isn't it the common carotid which then has branches in the cerebral works?
Does the external go inside the skull? Yes or no?
Yeah, no. I'm looking
Which
at Harriet.
one?
No.
Yes or no? It does.
Oh.
What does it go as? Middle meningeal artery. What does it supply? Meninges. Will it give you stroke? No. Okay. So as a stroke physician, if I see a clot dangling in external carotid artery, will I be worried? No. Because let it go. It don't give you stroke. It doesn't give any symptom whatsoever. Okay. So it doesn't matter. Whereas if I see a clot in internal, will I be worried? Yeah, it's like a time bomb waiting to explode. Okay. So internal, although it has got no branch, why no branch? It's keeping all his energy for the brain. So it has to go inside the skull and supply the brain. So how does it go inside the skull? Okay, this is the skull base.
Foramen magnum.
Oh my God.
Is that wrong?
Absolutely. Other artery goes through foramen magnum. So remember, it has to go, the middle cerebral or carotid artery goes through into the middle cranial fossa and anterior cranial fossa. So it has to enter through somewhere in the middle cranial fossa. It has to enter. So how does it enter? And the vertebral artery enters through the foramen magnum. Okay. How does it enter? It enters through the carotid canal. So this is the carotid canal. It enters through the carotid canal and goes through the petrous part of the temporal bone and come out in the foramen lacerum here by the side of the clinoid process. Okay. And then it travels along this part where there is cavernous sinus. It travels through the cavernous sinus. It goes upward and forward until it reaches the clinoid process. And then these internal carotid artery make a sharp bend, okay, and then give branches. Okay, if I draw it, this board is a bit low. It's difficult to draw. Have you not been taught about this course of the artery?
I think we have been told that it's gone through the carotid canal. That we should know.
I just want to pan it around.
So this is the anterior cranial fossa, this is the middle cranial fossa, this is the posterior cranial fossa. To make it oriented, so that's the lateral view. Okay? So the artery, this is our petrous part of the temporal bone. The artery enters through the carotid canal and it comes out through foramen lacerum. And from there it goes upward and forward until it causes the acute bend. And what is the structure we told it is going through is the cavernous sinus. Draw it properly. So it goes through the cavernous sinus. What are the other structures which are present in the cavernous sinus? Or if we draw another view, you have taken the upper half of the skull and you are looking from the top. So to orient it, this is the nose, these are the ears, okay? And this is the pituitary fossa. So the artery is entering through the foramen lacerum going through the cavernous sinus, and then it is dividing. So what are the branches after it has pierced the dura mater, which are important for clinical purpose? So that's the cavernous sinus. The artery is going upward, forward until it pierces the dura mater. Okay. So what are the branches? Ophthalmic artery. So this artery will come and it will supply the eye. Ophthalmic artery. What are the other branches?
Middle cerebral.
So middle cerebral artery, very good. What else?
Anterior.
So anterior cerebral, not anterior communicating, anterior cerebral. So these are the terminal branches. What else? There are two more important arteries. Posterior communicating, which is the connection between anterior and posterior circulation. What else? One more.
Anterior choroidal.
Very good. So anterior choroidal artery. Okay. What does anterior choroidal artery supply? Anterior part of choroid plexus. Anybody can remember. On top of that, optic tract. Okay. What does posterior communicating artery supply? It's communicate between anterior and posterior circulation. On top of that, it also gives some branches to thalamus. Is that clear? Okay. Now, anterior cerebral artery. What does it supply? So I'll use the brain to show it. See, the anterior cerebral artery this is the medial side of the brain, goes along the medial side above the corpus callosum, and it supplies the medial side of the frontal lobe and the medial side of the parietal lobe. It gives perforating arteries, lacunar arteries, to supply the corpus callosum, anterior 2/3 of the corpus callosum. Posterior 1/3 is supplied by posterior circulation. Okay, posterior cerebral artery. We'll come to that. Is that clear? So, what are the symptoms you can get in anterior cerebral artery stroke? It's very important MCQ question.
Like loss of lower limb movement.
Okay. So, as you can see, the frontal lobe medial part where the leg area is, you can get weakness of the lower limb more than upper limb. That's why. What else? If the parietal part is affected, what will you get?
Sensory.
Loss of sensation more in the leg than in the arm. What else is there? It's called paracentral lobule is there. Medial side. What is the function of that? Urinary incontinence you can get. Very important MCQ question. Anterior cerebral artery stroke. What else? See, this is the frontal lobe. This part is called cingulate gyrus. What is the function of cingulate gyrus? Motivation, attention, and behavior. Okay? So you can get those symptoms. You can get, so then there is supplementary motor area. What symptom can you get? You can get, patient might develop rigidity. It's called Gaggen-Halton sign. I'm stressing it comes in especially with the exam you will take, the board exam. These are the questions, very important. Gaggen-Halton sign, sucking reflex, palmomental reflex. This will come up in this if this supplementary motor area is affected. Obviously, if the medial part of the prefrontal cortex is affected, this is strongly related with limbic system. Okay, so they can get abulia, akinetic mutism. So all these are symptoms of the anterior circulation, anterior cerebral artery stroke, specifically of anterior circulation. Clear? Now for middle cerebral artery, what does it supply? It supplies the lateral side of the brain. Okay, it has got a superior division and it has got an inferior division. Superior division supplies the frontal, inferior division supplies the parietal and temporal. Again, there is MCQ which will come from this part. Okay, so what are the parts which are supplied by the middle cerebral artery? Lateral part of the frontal lobe, the orbital part as well, the parietal lobe, the lateral part, the superficial part of the temporal lobe, the insular cortex, and also internal capsule and part of the basal ganglion. So what could be the symptom of middle cerebral artery? Now, before I go to the whole symptom, if the superior division is affected, the frontal lobe is affected, what will be the symptom of the patient? So what is the function of the frontal lobe? Let's come to that. Primary function of frontal lobe. Primary function, that is the higher mental function. Primary function. Motor. Okay, motor, movement. What are the higher mental function? So, decision making, personality. What else? These are the lateral part. Or you want to do a motor action, you judge what will be the consequence of it. It's done by the dorsolateral prefrontal cortex. Okay, what else? Planning motor movement, attention, working memory. These are all higher mental function of the frontal lobe. So what are the higher mental function of the frontal lobe? Who can repeat what I have said? Primary function is motor. Higher mental function. Decision making.
Personality.
Executive decision making. What else?
Personality.
Personality. What else?
Risk assessment.
Risk assessment. Planning of movement. What else? Working memory. What else?
Attention.
Attention. What else? I haven't told two other important function. What is there? Speech area. Broca's. Expressive dysphasia. Okay. Especially if it is left hemisphere. Okay. What else is there? A bit higher up. Frontal eye field. Saccadic movement of the eye. Okay. So these are all the higher mental function associated with the frontal lobe. Primary function motor, and these are the higher mental function. What is the primary? So this part, if the superior division is affected, it will have all these symptoms. Whereas the inferior division is affected, which supply the lateral part of the parietal lobe and temporal lobe. What will be the symptom? Let's come to the parietal lobe. What are the functions of parietal lobe? Primary function, sensation. Very good. What are the associated function? Very important in exam. So higher cortical sensory function like graphesthesia, like stereognosis, like 2-point discrimination. Okay, these are just behind the postcentral gyrus. Okay, what else? It is mainly we take it as a part of the temporal. Okay, but they have got language. You know, they have got language function. What function? Reading and writing. That is the function of the parietal lobe. So what symptom patient can get? Agraphia, alexia, agraphia. Okay. What else are the function of the parietal lobe? So in the left hemisphere of the parietal lobe is affected, you get this language problem. Alexia, agraphia. Okay. There is a very important syndrome that is again exam in national board exam. Okay. Gartman syndrome. If it affects the left hemisphere, specifically angular gyrus. What is angular gyrus? So, you know, I've seen this coming in the exam. That's why I want to make it a point this year. You definitely know before you take the exam. Okay. So this is the Sylvian fissure. The gyrus in the parietal lobe is called supramarginal gyrus. Then you have got the superior temporal sulcus. When it goes to the parietal lobe, that's called angular gyrus. Okay. So that angular gyrus, if this is affected, what are the symptoms patient is going to get? Very important. Left hemisphere, if the angular gyrus is affected, they get Gaussman syndrome, where patient will have alexia, they will have agraphia, okay, inability to read, inability to write, dyscalculia, inability to calculate, that's again a function of the parietal lobe, okay. Left right dissociation, they won't be able to recognize which is left side, which is right side, okay. And finally, part of it is finger agnosia. They are not able to recognize which finger, thumb, index, middle, ring, little finger, they won't be able to, so it's called finger agnosia. So this is the Gaussman syndrome. This is left parietal lobe in the angular gyrus. It is a very important for exam. Okay. What else are the functions of parietal lobe? What is dorsal visual stream? What is ventral visual stream? So the occipital lobe, the visual information come. Okay. It helps to identify the, it helps to identify that there is an image. Then color and all these things are in the secondary area. Subsequently, two stream, dorsal, ventral. What does the dorsal stream do, which is going into the parietal lobe? It helps to identify where is this object in the three-dimensional space, at what speed this object is coming, from what exact direction it is coming. That is the function of the parietal lobe, superior part of the parietal lobe. Okay. What else? The left hemisphere, what else parietal lobe do? What is apraxia?
I think the phone's about to die.
Hmm?
I think the phone's about to die.
Is it about to die?
Yeah.
1 second. Can you sit over here and
Yeah.
because I can give the okay, you stop it there anyway, like, and then we will